about active targeting. Before this video we have seen some we have get some basic knowledge about active targeting, and in this video we will try to some their types, and going to into some more information about active targeting. And here the first is Seth approaching target. Seth Seth is a type is a first type of active example of first type of active targeting. Surface modification to enhance inset here is a here surface modification to enhance the hydrophilicity such that the target drug carrier system masquerade as a water body and escape ERS. Before in this video, we have seen the major challenge of drug targeting is ERS, escape the pass the barrier of ERS. So the modifications to the surface modification will enhance the hydrophilicity of drug carrier system, so it can easily escape the ERS and the masquerade as a water body. Most common use of selling agent is PEG, polyethylene glycol, and the process of attachment of PEG with the carrier system is known as pegylation. पेगालेशन के द्वारा जो ये अटैचमेंट होता है PEG का विथ कैरियर सिस्टम, इसको बोलते हैं पेगालेशन. Stimuli responsive. Second active targeting is a stimuli responsive. Stimuli, here is a pH stimuli. When stimuli responsive is based on pH of blood is 7.2 to 7.4, and the of tumor cell is 76.8 pH. So the pH of liposome is 4 to 5. So if we want to release a drug in tumor extracellular pH, we can make a liposome from the PAM and methacryl acid, methacrylic acid copolymer or nanoparticles from uh, fueling. So we use pH as a stimuli, pH as a trigger point to release the drug into the extracellular from extracellular. So there are different pH have shown in a differ in pH is important for the this pH stimuli. Second, this dissolved this जो copolymer as a nanoparticle form polyen. So this dissolve at the pH 6 point, and we want pH 6 point pH पे ये जो drugs है वो dissolve हो जाएगा. So if we want to deliver the drug at endosomal zone, we can make micellus made from PEG block poly beta benzyl aspartate copolymer or di block copolymer compound of polylactic acid and methoxy via hydrogen and bond, which dissolve at pH 4 to 6. जो ये जो होगा ये जो ड्रग्स कैरियर होगा ये pH 4 to 5 पर डिजॉल्व हो जाएगा. थर्मल स्टिमुलाई. In thermal stimuli, we thermosensitive carriers should retain their load at body temperature and rapidly deliver the drug in a local area having a higher temperature, which is normally seen in case of tumor pyrogen. यहाँ पे जो थर्मल स्टिमुलाई में क्या होता है कि बेसिस ऑन द थर्मल temperature or basis on the temperature drugs carrier release the drugs in that part where the temperature of that part is temperature of release part is higher than the normal temperature. So this temperature difference is a key factor for the thermal stimuli. Thermosensitive polymers, we use thermosensitive polymer in this in here. Some of thermosensitive polymers are poly and vinyl, uh, caprolactam, poly and isopropyl acrylamide, and ethyl ethyl methyl acrylamide, and poly and ethyl acrylamide. These are the example of thermosensitive polymers. And the ultrasound stimuli. Here the ultrasound waves propagate through the body tissue, loading to several physical effects which can be used as a trigger for the drug release. Here the ultrasound wave को use किया जाता है properties wave properties for the releasing trigger for the drug release. Simple pressure variation as to so these triggers can be simple pressure variation, acoustic fluid streaming, cavitation, and local hyperthermia. Local hyperthermia. These are the trigger. These are the can be trigger points. Magnetic stimuli. In magnetic stimuli क्या होता है? Magnetic carrier injected into the bloodstream and retained at the target site by application of external magnetic field or an internally implemented permanent magnet. The ability of magnetic particles to concentrate will depend upon blood flow rate and the intensity of the magnetic field. Magnetic materials used. Magnetic field. Here the magnetic material used are in magnetic iron, magnetite, iron, cobalt, nickel. These are the magnetic material that is used in magnetic stimuli. Here the magnetic field for the drug delivery. And the third one is a receptor mediated targeting. In receptor mediated targeting में क्या होता है कि certain receptor are overexpressed on cancer cell surface. So these receptor used for them. According to these receptor, these receptor are flatted receptor, flow receptor, uh, mannose receptor and mannose receptor, transferrin receptor, ASGPR receptor. These are the receptor. This is according to their properties of these receptor and responses. We design a drug and use this receptor to deliver our drug into the cell. Antibody mediated targeting. There are certain receptor which are expressed on the tumor cell. According to these receptor, we use their anti receptor for our drug delivery system. Here different जो रिसेप्टर होते हैं उनके एंटी रिसेप्टर को यूज़ करके हम लोग यूज़ करते हैं फॉर अवर ड्रग डिलीवरी सिस्टम. दिस नोन एज द एंटीबॉडी mediated targeting. Here are some different target moieties attached to the carrier. This is the carrier and this is the moieties peptide. It could be a peptide, P, polyethyl, and antibody, fluorescent probe, folic acid, drug, and antimin. These are the can be different type. This is all about active targeting.